Well, good afternoon, everyone, and it's great to be here in beautiful Etobicoke. With our outstanding Education Minister, Stephen Lecce, our hometown champions, Minister Kinga Surma, and MPP Christine Hogarth. I'd also like to recognize Dr. Yaffe, as well as our local councillors, Deputy Mayor Holiday, Councillor Grimes, Councillor Ford, Trustees Teresa Lubinski, and Marcus D. Domenico. And I love that, D. Domenico. I love Marcus. This guy's a champ too. And Toronto District Catholic School Board, along with Bishop Allen's champion, Principal Lisa Tomachek. Folks, this is a team that is working hard to deliver results. And today's incredible announcement is proof that we're getting things done. And I always want to take this opportunity to thank the wonderful, and I want to emphasize the wonderful teachers, EAs, principals, custodians, and education staff, everyone who's been working tirelessly to keep our schools safe and our classrooms open. This is a growing community, and there's a lot of young families, and we have to make sure we're keeping pace with that growth and investing in the future. That means getting shovels in the ground now on better transit, more hospital beds, and modern schools, because every parent wants their child to have the access to the best education, to the best teachers and classrooms with an excellent learning environment. Our schools provide a solid foundation for our young people for their lifelong success, and we have to provide a solid foundation for our schools by making the necessary investments to rebuild and renovate. Over the next 10 years, we're investing $12 billion to build new schools and upgrade existing ones. And that includes new builds here in Etobicoke. And I'm thrilled to announce, after decades and decades of being ignored, we're here at the table. We're investing over $62 million to build 2 brand new Catholic secondary schools. These new schools will be able to accommodate over 2,000 students. We're providing $36 million for Bishop Allen Academy so they can build a brand new school that will accommodate 1,300 students. We've also approved over $26 million for another secondary school in Etobicoke Centre. This is great news. We're delivering a brand new school in Etobicoke Centre that will accommodate 900 students. And I have to thank Kinga and Christine for their hard work to get these 2 great projects off the ground. My friends, our schools are the heart of our community. When we invest in our schools, we're investing in our future, in the next generation of engineers, teachers, scientists, tradespeople. For me, it's one of the best investments our government can make. Before I pass it to the minister, I'd like to share a message with all small business owners out there. We know you're facing a lot of hardship right now. That's why we've committed to providing up to $300 million to support small businesses impacted by modified stage 2 restrictions with fixed cost. And I also want to be very clear. No small business owner should have to lose their life's work because their landlord wouldn't give them a break. And I know there are a lot of great landlords out there who are working very hard with their tenants. While we work with the federal government to extend the commercial rent relief program for small businesses, we'll be introducing legislation in the coming days to extend the ban on commercial evictions to protect small business owners. I know that there are many small businesses out there that are struggling, and we need to rally around them. And based on the evidence I'm seeing, the measures we had to take on October the 10th, they've had an effect. And my friends, they are working. They were never intended to be long-term solutions. These were short-term, difficult, and very difficult measures that were necessary at the time to avoid reaching a point where far more drastic measures may be needed. As we're now seeing in France, you see it in Spain, you see it in Ireland, in France, they've hit 52,000 cases a day. And they've implemented a full lockdown like a lot of other countries. We couldn't let that happen here in Ontario, but based on the latest evidence, based on what I'm seeing in the modeling, I have asked our public health experts to come back next week with a plan to begin to ease restrictions. in a way that is safely allows businesses to start opening back up after the 28-day period is over. I want the health officials to come up with a plan that lets business operate safely, because we don't know how long this virus will be with us. But my friends, what we do know is that together we're going to get through this. Together we're going to rebuild what we've lost, and we will come back stronger and more united than ever before. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Lecce.
Well, thank you very much, Premier. It is exciting to be here at Bishop Allen Academy. I just want to say off the top how proud I am to stand with my colleagues, Kinga Surma, Christine Hogarth. These are incredible champions and advocates for the people of Etobicoke. And I was here at this school, in fact, just in August with our principal, Lisa Tomacek, who's just with us today, with our trustee, Teresa, and others. And I just want to say to you, Lisa, thank you so much for your hard work and advocacy, for helping me understand these needs, and really for rallying your community to give them hope that there's a new school coming to this amazing educational institution. Today's announcement is great news for students and educators, parents right here in Etobicoke, on Lakeshore, and in Etobicoke Centre. I want to start by thanking the Premier for his strong leadership and commitment to the students and families of this province. And as well, I want to just build upon the point for Kinga and Christine for their tireless advocacy to get these projects done. They're going to make a big difference in the lives of young people. Today's investment of more than $60 million will ensure that local students and their families have access to modern, state-of-the-art, and technologically connected schools. Overall, our government is investing, as the Premier noted, over $12 billion over the next decade within our schools. And that includes $550 million this year alone to build 20 new schools and upgrade 8 existing facilities. This funding is another example of how our government is leading the way to improve learning outcomes for our kids. Now, since the beginning of the COVID-19 pandemic, our government has approved over $900 million in funding for education infrastructure, including 50 net new schools, 23 major additions to existing schools, and nearly 1,800 new, licensed, affordable childcare spaces for the people of this province. These are just some of the elements we're doing, but beyond the bricks and the mortar, they are launching pads for lifelong learning and future success. Our government will continue to invest in students because we believe that the children of this province deserve every opportunity to realize their full potential. Thank you. It's now my pleasure to invite to the podium local Toronto Catholic District School Board trustee Teresa Lubinski.
Thank you, Minister Lecce. Good afternoon. I would like to give a very special thank you to Premier Doug Ford, Minister of Education Stephen Lecce, Minister Kinga Surma, local MPP Christine Hogarth, Deputy Mayor Stephen Holliday, Councillor Mark Grimes, Councillor Michael Ford, Director of Education Dr. Brendan Brown, Principal Lisa Tomacek, and Superintendent for the area Joe Bria. My name is Teresa Lubinski, and I am the Catholic School Board Trustee for Bishop Allen and all 18 Catholic schools of Ward 4. I am also the proud mother of 2 children who've had the privilege of attending Bishop Allen Academy, whose long overdue renewal of funding the Premier has announced here today. As most of you know, Bishop Allen Academy has struggled for many years to accommodate far more students than its present facilities were meant for. Many of our schools experience overcrowding and adopt temporary solutions, such as using portables, and Bishop Allen is no exception. Despite these challenges, Bishop Allen's enrollment has more than doubled in recent years, attracting not only Catholic students, but also non-Catholic and many international students. This is not only a tribute to this school's academic reputation, but a tribute to a welcoming community that its students and staff have created. For the Catholic community here in the Etobicoke-Lakeshore, this day has been a dream for many years. It's with deep gratitude that I thank the government under Premier Ford and his Education Minister Stephen Lecce, as well as MPPs Christine Hogarth and Kinga Surma, who took time from their busy schedule during the summer to personally visit our school to see for themselves the pressing needs for our community. I also extend a special thanks to the Parent Council, the staff, and the current principal of Bishop Allen, of whom have and will continue to do more than their fair share, welcoming all of inconveniences the fruition of this dream will certainly entail, both for the sake of the current students and for all future generations. Premier Ford, to you and all of your team, thank you very much. Now it is my pleasure to turn the podium over to Minister Kinga Surma.
Thank you very much, Teresa. And thank you, Premier Ford. Under your leadership, we are making historic investments in our children's future. First, I want to acknowledge the important work that my colleague, Minister Lecce, and our partners at the Toronto Catholic District School Board are doing to protect and strengthen Ontario's world-class public education system. I also look forward to further collaborating with local trustee Marcus D. Domenico and Deputy Mayor Stephen Holiday to deliver this project for our community. I am extremely proud to be here today to participate in this funding announcement for a new Catholic secondary school in Etobicoke Centre. Many families choose to call Etobicoke home because of the access to housing, great schools and jobs, and the strength of character and spirit in our local neighborhoods. While more families have settled in central Etobicoke and the population has steadily climbed to new heights, our community has long battled a critical need for another Catholic secondary school to relieve the pressure on enrollment at Michael Power. That is why I'm pleased to share that this new school will open its doors to 900 local students and thousands more in decades to come. With the new local Catholic secondary school, parents and students alike will no longer have to tolerate long-distance commutes to schools in neighboring communities. Valuable time will be gained and better spent learning, playing with friends, and in the company of family. This is a huge win for the local, hardworking families whose children will be given the very best chance to succeed. Our government will continue to listen and honor the need for critical infrastructure investments which have been talked about in our community for years and are finally becoming a reality. Thank you. I'd now like to invite to the podium the Member of Provincial Parliament for Etobicoke-Lakeshore, Christine.
Good afternoon, and thank you very much, Minister Surma. It is my pleasure to join my colleague, the Premier Ford, for this exciting announcement today. I want to thank the Premier for his leadership on this issue and for deciding early on that our government would invest in what matters most, Ontario's children. I must also thank and acknowledge my colleague, Stephen Lecce, the Minister of Education, who has made such an important headway in providing communities with the schools and resources they need, especially during this most recent period. I feel confident in saying that today's announcement is the single most important announcement that I have had the privilege to make to families and residents of Etobicoke-Lakeshore since they elected me to serve them in 2018. The parents and members of our community have done an exemplary job in explaining why this new school facility is so crucially important and provided us with continuous support and the helpful information we needed to champion this effort. Staff and teachers at Bishop Allen Academy, under the outstanding leadership of Principal Lisa Tomacek, have done a tremendous job over the past years, providing students with quality learning environment they need to succeed. And I can only imagine how excited they will be when they can continue this life-changing work in a beautiful, brand new, state-of-the-art facility. The students of the future who will attend this new school will have many committed and caring adults to thank them for their new school. Our government is committed to modernizing Ontario's education system to better meet the needs of Ontario's students and their families. I believe I speak for MPP Surma and myself when we say that our community feels listened to and that the investments announced here today are certainly needed and most certainly welcome. Thank you for joining us today, And thank you for sharing this amazing news.
Great, thank you. Okay.
We'll go to the phone line for questions. Just a reminder, it's one question and one follow-up, please.
First question comes from Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. Wanted to ask you if you could elaborate a little bit more on your comments there about the reopening announcement that you're planning next week. I'm wondering if you can specifically point to yesterday's modeling presentation and data there that gives you a sense that it would be safe to lift restrictions that have been put in place in hotspots, even in a modified way. And can you say now what that will mean for indoor dining at restaurants and gyms?
Well, I've asked the health team to look at easing the restrictions to be able to move forward in a safe manner. They're putting that together. They're going to present that to me, and we'll bring it in front of cabinet and caucus, and we'll make a decision.
Follow-up?
And Premier, I wanted to also ask you about the Ontario Hospital Association and some comments that their president has made to me today about hospitals and what he describes as unprecedented financial pressure that they're under right now because of the pandemic. And he says that while your government has definitely promised funding, it hasn't flown it to them in large part. And Premier, given the importance of hospitals to the province's pandemic response, I'm wondering what the holdup is.
Well, we've put $7.7 billion into healthcare so far. Any hospital that needs our support, we're there at the front door working with them. We're getting money flowing, but we also have to make sure that we have a little contingency as well for 3 months down the road, 4 months down the road, and we're funding the healthcare system by far more than any jurisdiction in this country, more than any previous government in the history of this province. And we're going to continue making sure we have a strong healthcare system, because without the healthcare system, strong healthcare system, we don't have an economy, and vice versa. So we're pouring money into healthcare, and I'll give the president of OHA a call and see exactly what he's talking about, because he likes sending out letters without giving us a call.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I'm just picking up on Sean's first question there. Sure. The 7-day moving average is higher now than when you put Toronto, York, and Peel into stage 2. So I'm wondering what was in the numbers in that modeling briefing yesterday that has this change of heart, so to speak, with maybe a more tailored approach to what can be open and what can't be. I'm looking at some of the pie charts here. Yep. Toronto restaurants, bars, and clubs accounted for 14% of cases. In Ottawa, it was just 2% of cases. So what's changed in all this for you to go to this new direction? Yep. And what can people expect to see?
Yeah, so before I pass it to Dr. Yaffe there, when they brought this decision to me, and believe me, I don't know if you remember, it was probably one of the toughest decisions I had to make. We saw a spike at 200% in ICU beds, and I truly believe if we didn't make this decision, we would be having a different conversation today. We'd be having a conversation possibly like France or like Spain, but because we made this decision, we aren't doing too bad actually compared to the rest of the world. We're seeing the trend in Ottawa. Let's use Ottawa for example. They had the largest percentage of spread anywhere in this country, and I was really concerned, and so was the health team. And I want to congratulate the people of Ottawa, because now we see the trend going the other way. But I'll pass it to Dr. Yaffe.
Thank you very much, Premier. Obviously, we are having significant community spread of COVID-19 in certain parts of the province. What we're trying to do with our strategy, obviously, is to prevent spread, prevent cases, prevent more illness and death. Also, very importantly, keep the schools open and safe, and prevent illness in those who are particularly vulnerable, people in long-term care facilities, retirement homes, and so on. So we look at what happened before we implemented the modified stage 2. If you saw the circles then, something like 30 to 40% of outbreaks, particularly in Toronto and in Ottawa, were in restaurants or gyms. Of course, now that you look at what you saw yesterday was a combination of the data for the last 2 months, and things have gotten better in those settings, which is great. Those settings are places where people can congregate inside for significant periods of time. They may be somewhat crowded, and obviously if they're eating, they take their mask off. If they're exercising, they tend not to wear a mask, and they may be breathing heavily. So those are the conditions that are very amenable to transmission of this virus. When you get an outbreak in a school or a long-term care facility, it didn't come from nowhere, it came from the community. And we know that the settings where people get it tend to be settings where people spend time together indoors for extended period of time. So that is really the rationale for why we focused in on restaurants, bars, and gyms. Obviously, we are continuing to review the data. We look at a number of factors, including the number of cases, the percentage positive lab reports, the public health system capacity around testing, case and contact management, and the health system capacity. And as you saw yesterday, the numbers are still going up, but they're going up slower. So what it's saying to us is we can look at perhaps modifying the conditions, but that doesn't mean everyone can loosen up on everything we all need to do. Don't go out if you're sick. Wash your hands. Wear a mask if you can't stay at least 2 meters away from people. Social distancing, and so on. So that is really the bottom line here. We're trying to balance the risks and benefits of each measure that we take, recognizing that each of them does have potential negative consequences, but on the other hand, if we don't do them, things could be a lot worse.
Follow-up?
Yes, thanks for that explanation. Premier, I just wanted to ask about the outbreak in your constituent office up at Albion and Islington. Apparently the office has been closed all week. What more can you tell us about how it occurred, how many people are involved, and why didn't you tell us sooner?
Well, the outbreak took place probably a few days ago. I had 3 of my constituent folks. They've locked down the office. We're still taking calls. They're doing okay. That's the most important thing. But that's what happens when a lot of MPPs, and I have no problem with that, kept their doors locked. We took a different approach. We kept them open. So we had a few visitors come in, and that's where they believe they contacted COVID.
Next question.
Next question comes from Amit Singh at Saga 960. Please go ahead.
Amit, how you doing?
Good afternoon, Premier. Premier, your Premier's Council of Improving Healthcare and Ending Hallway Medicine put out a report. Recommendation 9 recommends building a new appropriate healthcare system for the future. October 23rd, Premier, you were in Picton announcing an investment of $8.7 million to build a brand new hospital for Prince Edward County. Premier, you were also in Brampton on October 28th, but we did not hear any announcement in terms of phase 2 or a new hospital. I just wanted to get an idea, what evidence-based approach does your Council on Improving Healthcare and your government take to select evidence-based approaches to select which funding projects they go ahead with? Is it based on need?
Well, right away, it's based on need. We see Brampton. I'll use Brampton, for example. Yes, we have to get the money flowing for the planning of phase 2. When it comes to Brampton, it's one of the fastest growing cities in our province there. So we're going to do that. We're investing, I believe it's 26 billion into putting new hospitals, brand new hospitals across the province over the next 10 years. But we have to keep up with the growth of each area, and when we see the growth happening, we're going to be there to support the hospitals. A lot of these hospitals, by the way, have been around for 60, 70 years, and I'll be very frank. They've been ignored for decades. We aren't ignoring it anymore. We aren't ignoring building new schools or building new hospitals. I said when I got elected, we're going to spend $144 billion over the next 10 years into building hospitals, building schools, building infrastructure, and that's what we're going to continue doing.
Follow-up?
Premier, November 5th, the budget is being announced. Is there any line items for Brampton specifically for a second emergency hospital or phase 2 funding?
I wish I could tell you, but you're going to have to wait until we announce that on November 5th. But this is a really good news budget. It's about supporting people, protecting people, looking at how we're going to recover economically. So they've put a lot of work into it. All ministers have, and I want to thank him. I want to thank the Minister of Finance as well. They've put together a fabulous budget for the people of Ontario.
Next question.
Next question comes from Cynthia Milliken at City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier.
Hi.
I'm wondering exactly when you saw the data that suggested only 14% of restaurants and 3% of gyms, for example, in Toronto, were the origin of outbreaks. When did you actually see that specific data? And was your team on board for your cabinet, your caucus on board for shutting down indoor dining in gyms? Did they know that was the specific number?
Yeah, so I've always said, and I've been very transparent with this, when you have 72 members, everyone has differing opinions, and I respect that. I like the debate. When we go into caucus or cabinet, we have debates going back and forth. But Cynthia, at the end of the day, I have to make a decision. I'm not a type of politician or elected official that likes going out there and 1 second supporting a lockdown and then going out there and say, oh no, we don't, which a few have done, which is a little disturbing. I'm responsible. I'm the Premier. I will take the full responsibility. It was the right decision. When we see the ICU capacity go up 200%, when we see cases jumping up close to double, and I get advice from my health officials, I follow that advice. And maybe a lot of people don't disagree, or may disagree with me, and some agree. But it's not easy, Cynthia, I'll tell you. When you're trying to balance the health and safety of 14.5 million people, along with keeping the economy going, it's not easy. But I think we made the right decision because, as I mentioned before, you're seeing what's happening around the world. And if we didn't make these decisions, we could be possibly having a different conversation today. And, I'm there to support small businesses, and it was a difficult decision. But we're going to look at easing the restrictions safely, and I emphasize that, safely. And as Dr. Yaffe said, please do not let your guard down. We had it. 14.5 million people worked so hard, and we had it down below 100 cases. It's unheard of anywhere in the world. And then we let our guard down, and we're in the spot that we are today. And actually, we aren't doing terrible compared to the rest of the world. We're doing pretty good, actually.
Follow-up?
You mentioned the word surgical twice yesterday.
Yes.
And talked about how even regions like Peel or Toronto have great disparities in COVID cases. It's not just province-wide, it can even be in specific regions.
Yeah.
Are you looking at, are you asking your team to look at, for example, where your riding is, there's a very, very high prevalence of COVID. Would you toughen restrictions there, but perhaps ease them in other parts of the city where there aren't as many cases?
Yeah, good question, Cynthia. And that's the approach I'd like to take. Again, I'll always rely on the health and science. But yes, Etobicoke North, certain pockets of Etobicoke North, we do see an outbreak. In other areas of Etobicoke, it's a big area. We don't see it. And all my point is always, we're going through a lot of tough times, a lot of bumps in the road, but I can't punish everyone and paint a broad brush if there's just one pocket of a city or a town that's infected. It's just not fair to everyone else. We have a big city, you know, close to 3 million people here in Toronto. And if we have an outbreak there, then we deal with those cases. But that's what I'm asking our health team to come back to see how they could ease the restrictions. And they're doing a great job. You know, Cynthia, they get a lot of heat, our health team. These are folks that have the best interest of everyone at heart. It's like I use the comparison, you know, people that want to go after my health team or whatever. When you go to your doctor and you have an illness, are you going to ignore the doctor and say, forget it, they don't know? No, you aren't. You're going to listen to the specialists. You're going to listen to the docs, as I'm doing. And believe me, nothing kills me more than shutting anything down. But I'll always listen to the health professionals.
Next question.
Next question comes from Jeff Gray at the Globe and Mail. Please go ahead.
Hi, Jeff.
Oh, hi, Premier. Hi, thanks. Just to pick up on that last point, you know, I've talked to a lot of health experts and so on who, while encouraged by the data that came out yesterday that you referenced, are saying it's not time to loosen things yet. Dr. Williams sort of said he needed to see some more information next week before he made such a decision. Is it possible that your health team will come back to you and say, we don't think you should do this, and you'll follow their advice?
Well, anything's possible. Again, I'm going to rely on the data and the advice from the health team, but this can't go on indefinitely. You know, again, one doesn't work without the other. Without your health, you don't have the economy, and if the economy goes south, then there's a lot of people with health issues, mental health, depression, addiction. So there's a happy balance, and we'll find that happy balance with our health team. And again, you know, we have docs on both sides. And by the way, we have the best docs in the whole world. It doesn't matter if they agree or disagree. We have some docs on the panel that may disagree too. But I think that's healthy, a healthy democracy. And they come up with a solution. And honestly, that's why Ontario and Canada is doing really, really fair, good. Not great, but good compared to the other countries. We have to look at our friends down south. We're all hex breaking loose, not only politically breaking loose, but health-wise breaking loose. So I don't agree with that approach down there. I don't agree. There's a lot of approaches, but I do agree with our health team and the effort they're putting in.
Follow-up?
Yeah, just some infectious disease experts are saying that sort of bubbling along at the 800 to 1,000 cases that we're at now is actually sort of a danger level that other countries that were in a similar position, some of the ones you mentioned in Europe, very quickly saw things spiral out of control as they loosened things. And Dr. Williams even said, you know, that a worst case scenario might be that you open things and a week later have to shut them again. Are you I mean, is there a danger that we go too far with the reopening, or are you looking at really some modifications to these restrictions, not lifting them entirely?
Yeah, I think we have to ease them a little bit, but then again, I'm not the doctor and I don't have a crystal ball, and I couldn't tell you 2 weeks down the road. Matter of fact, no doc could tell you what's going to happen 2, 3, 4 weeks down the road, but they do measure what we've seen over the last 2 to 3 weeks, and I'm going to rely on their advice, but with a very happy balance. You know, I've heard all this, you know, the docs are giving you bad advice, the docs are giving you good advice. Man, I have the best docs in the entire world, and I'm so grateful for the work that they've done in the endless hours, and they're responsible for keeping our province safe, and they've done a great job. Not all the docs, they're fabulous, and I'm very, very grateful.
Last question.
Last question comes from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. My question is for you and Dr. Yaffe. With this new federal modeling and the number of outbreaks that have been linked to social gatherings, Dr. Teresa Tam said this morning that Canadians will need to reduce their current rate of contacts by 25% in order to curb the second wave of COVID. So are you and your health command table considering lowering the limits of social gatherings from 10 indoors and 25 outdoors? And if so, when can we expect a decision by?
Yeah, Haley, another great question, and this is the in-depth analysis that a lot of people may not see on a daily basis. We're posting it online, but what we did see, and I'll pass it over to Dr. Yaffe, what we did see when we did contact tracing, at the beginning, we'd be able to contact 10 people and trace them. Now, people are interacting with 50 to 100. And if you have 100 cases times 100, 10,000 contact tracing, and then those people contact 100, and those people, next thing you know, it just flies out of control. But what we're really concerned about is the amount of people that people are in contact with. So it's just a multiple effect, and I'll have Dr. Yaffe come up.
Yeah, thank you. I think the bottom line is, yes, we will review that, obviously, and consider whether we need to change the guidelines. But I think everybody just needs to remember how this infection is spread. It's spread, generally speaking, between people. So if you're with people that are not people in your household, people you live with, you should be careful. You should minimize your contact with other people, especially within 2 meters, wear a mask, and don't do anything that's not essential. I mean, go to work, go to school, groceries and so on, medical appointments, but we really need to try and minimize the amount of interaction we have with other people. Keeping in mind, obviously, if somebody lives alone, they should be interacting with, hopefully another household so that they don't get social isolation. So we need to look at the numbers, yes, but everybody just has to keep that in mind. Interacting with people is how you get it. It's spread through droplets primarily. Wash your hands if you're touching surfaces.
Follow-up?
Follow-up. So will this federal modeling impact the capacity restrictions for restaurants, bars, and gyms that will be announced next week? Because a lot of restaurant owners I've spoken with say they could handle 25% capacity indoors. Anything less than that probably might not make it worth it. So could we possibly be looking at something like 10%, 15% capacity indoors?
The public health measures table is looking at all the possibilities. What needs to be done to minimize transmission, and also consulting with the local medical officer of health about the local context. So I really can't say exactly what the measures or the options will be, but certainly they'll be coming forward with recommendations to the government.
Thank you, everyone.
Thank you, everyone. Have a great, safe Halloween and great weekend. Thank you.